I'm just going to wait one more minute. I realize it's 6:30. We just give everybody one more minute to sign in, and then we'll get started.
We have about 5 in right now, it looks like, Katie. I don't know if you can see that or not. 6.
Thank you. Okay. Not anybody else is really joining yet. So I think I'll just get us started with who is already here, and we'll let them just join in as I'm talking. First of all, I want to get started by thanking everybody for being here tonight to listen to our presentation about suicide prevention. It's such an important topic, and I'm so glad that everybody could come tonight. My name is Katie Boggs, and I am co-host of the Mental Health Initiative Committee, which is a part of the PTSO at Myers Park. I'm also a parent of a sophomore at the high school, and I'm a licensed psychologist that who works with families and children in our community. I'm going to pass this on to my other co-host, Kylie, who is going to introduce herself and the speakers.
Thank you, Katie. And I am Kylie Thiel, and I'm also the parent of a sophomore at Myers Park, and I am a licensed clinical mental health counselor in the community as well. And we are so very grateful to have back with us again our presenters tonight, Jennifer Feitz and Dr. Amanda McGow from Base Cognitive Behavioral. Jennifer is a licensed clinical mental health counselor and national certified counselor. Jennifer specializes in treating grief and bereavement, trauma, post-traumatic stress disorder, and suicidality and suicide loss. Jennifer is certified eye movement desensitization reprocessing, or EMDR, psychotherapist, and is a member of the Dialectical Behavior Therapy, DBT team. Jennifer works with adults and teens in the Charlotte area. And we also have with us tonight Dr. McGow, and she is a licensed psychologist. And Amanda specializes in treating clients with suicidality, self-harm behaviors, suicide loss, and providing trainings around suicide prevention and suicide loss. She also provides family therapy, dialectical behavioral therapy, and treats anxiety, depression, and life transitions. Amanda works with children, adolescents, and adults, and currently serves as the president of the American Foundation for Suicide Prevention's North Carolina chapter. We are so very grateful to have both of them. They are doing great work in our community and clearly do a lot of different things and have a lot of experience. As we turn over the floor to them to present, you can see at the bottom of your screen, there's a Q&A box. If you have questions while they are presenting, please feel free to type that into the box, and Katie and I will monitor that and be able to ask those questions for our presenters during the presentation and when it ends. I'll turn it over now. Thank you so much.
Thank you so much, Katie and Kylie. We're going to go ahead and start sharing the presentation with you all. And like Kylie was saying, please share any questions that you have. There are absolutely no bad questions at all when it comes to this topic. I just want to start by thanking each of you for joining us tonight, because This is a topic that sometimes people can easily push to the side and think, I don't need to learn about that. That's not my family. That's not going to be anything that touches my life. And the reality is that suicide can absolutely affect anyone. This is truly something that we all need to be educated about, because learning how to look for the signs, how to talk to somebody if you think they might be at risk, is a critical component to preventing losing someone that you love to suicide. So I really appreciate and have a lot of respect for you all taking time out of your evening tonight. So thank you. We're going to cover a few things with you all this evening. I'm going to let you know a little bit about what we currently know about suicide in the field. We're going to talk about what are risk factors and warning signs that we all can be on the watch for. Then Jennifer's going to talk to us about what are some protective factors. How can we help build some resilience in our teens and for ourselves? And then how can we have those conversations about mental health and suicide? And then what are your national resources, as well as talking about locally what you can do if you are worried about anyone. So one thing that we know currently is that suicide is the 12th leading cause of death overall across all age ranges. So this really is a significant public health issue. When you think about that, we're talking about basically being behind, accidents and certain types of cancer, heart disease, and then you really have suicide following up right after that. So this is something that we all need to know more about. We're losing on average right now in the United States 130 people a day. And to give you a sense of what that means, I want you to think about, the last time you flew on a commercial, airplane, for example. Like if you looked around your airline and the number of people that were on it, unless you were on one of those super jumbo jets, going across the seas or whatever, you were basically looking at around 130 people. If each and every day we had an entire airliner full of people crashing and dying, our country would absolutely not allow that. We would stop that. And in fact, there have been times in our history where certain airplanes had problems and we did immediately stop that. And yet with the issue of suicide, we tend to be reluctant to talk about it. And that's something that we have to change as a community. And I'm so grateful that Myers Park High School is really leaning into changing in their community. We do know that typically for a lot of individuals, the first time that they have a thought of suicide, of ending their life, is during their teenage years. Just because we have a thought of suicide doesn't mean that we're going to die by suicide. In fact, many people have thoughts of suicide at some point in their life. But what this really highlights is that this is an important time for us to make sure that we are beginning important conversations about mental health and suicide with our teens that we love so much. For teenagers specifically, I mentioned it's the 12th overall leading cause of death across all ages, but for teenagers, it's the 3rd leading cause of death, all the way through our college age students, right? So this is important information, not only to talk about now as your kids are in high school, but to continue an open conversation about as they launch into college and beyond. Suicide happens as the 3rd leading cause of death, only behind accidents and then violence through guns, right? So it's typically homicide in that type of situation. So we really need to address this. To bring it home, more of a local level, there is a large national study that's done every few years. They're a little bit behind right now because of COVID, but the most up-to-date research that we have, based on what questionnaires that were filled out by high schoolers and middle schoolers right here in Mecklenburg County in our public school system, indicate that 21.4% of middle schoolers and 16.2% of our high schoolers had serious thoughts of suicide in 2019. Now, I don't know about for you guys, but for me, when I saw this the first time, it hit me hard to think, I could walk into my daughter's middle school and 1 out of 5 of them is having serious thoughts of suicide. Now that word was included, serious, okay? So this goes beyond just a fleeting thought per se. And then 16.2% of our high schoolers. And this is part of why I started at the beginning of saying this could really affect anybody. This is not just one type of human that might encounter suicidality. This is why we have to talk about this with our young people. So one of the things that we know about what happens when someone is suicidal is that they are in the midst of some kind of crisis. We'll talk a little bit more about this in a minute, but there's something that's happening in their life that has reached a crisis point. And they are experiencing significant emotional pain as a part of that. And they desperately want to get out of that pain, and they cannot think or see any other options. Their thinking becomes very myopic. It's a lot like putting on blinders. You cannot see anything that you would normally be able to see as a solution, or sometimes even as a support and a way out. So we're going to talk more about how to navigate that. As we have this conversation tonight, I just want to briefly bring your attention to the fact that the way that we discuss suicide does in fact matter. Words can carry weight, and we try to encourage people to join us in avoiding saying committed suicide, because if you think about what else we use with the term committed, we talk about committed a crime, committed a sin. Those are very stigmatized words. So instead, we want to use died by suicide or ended their life when we talk about suicide. We also want to be careful that if we are talking about an attempt that has occurred, that we do not call a attempt successful, for example, meaning someone has died. That is the worst outcome that we can possibly imagine. So we don't want to label that as successful. Or, for example, a failed attempt. That's not a failure to still be here. We want those people who have had an attempt on ending their life to still be with us, so that there's a chance for them to find a life worth living. We want to be very mindful of not using value judgments when we talk about suicide. Jennifer and I have both worked a lot with suicidal adolescents, and I think about someone I worked with a long time ago who, when I asked her, why did you not share that you were having these thoughts of suicide with your parents? Like, what held you back from doing that? She referenced the fact that her parents had been very judgmental of a celebrity who died by suicide, that they were selfish and that they were weak and they should have found a way out, and how dare someone who has all those things going for them make that decision. She heard all of that and then did not share her own experience with them. So be mindful that what we are saying, whether we're talking about our own family member or just, a celebrity like in this example, our kids are hearing. So we have to make it safe to talk about suicide. And then we want to, on the other hand, make sure we're not doing anything that glamorizes suicide, that makes it more appealing in some way, because obviously suicide is not the solution that we want people to seek. We want them to find healthy ways of coping with the things that have created that crisis in their life. And so as a part of that, we're going to try to stick to the facts. And if a suicide has occurred in our community, or even a celebrity maybe that our child is following or is interested in, we want to be mindful that we talk about that there are other options and other supports available. So let's dive in a little bit to, well, let me stop right there first. Let me ask, are there any questions that we have so far before we start talking about warning signs and risk factors? All right, we'll keep moving along for now then. So let's talk first about our risk factors. If you think about risk, we are talking about something that might increase the likelihood of suicide occurring, but does not mean that suicide absolutely will occur. Think about risk factors for heart disease, for example. If you have a family history of heart disease or high cholesterol, things like that, you may know that those are risk factors, but that does not in fact mean that you are for certain going to have a heart attack. But we want to take those risk factors seriously and do what we can to prevent them from becoming a problem. So as we think about risk factors, we first have to take a look at the fact that we know that there is no single cause for a person ending their life. It's never just one thing. It's many things that have combined. But as humans, we naturally, when something that is so inexplicable, like a loved one or someone we know taking their life, we look for answers. We want to immediately say, why did this happen? And what happens in a situation like that is that each of us can individually see is the tip of the iceberg. We don't have all of the information. So we might jump to conclusions like, oh, well, she had problems in her relationship with her parents, or, oh, he had just been through a breakup, or, oh, this person had a lot of stress, you know, within their finances, right? We start to look at what we can see on the surface, but it's absolutely more complex than that. And again, it's never just one thing. It's a perfect storm of things that combine. So as we think, what are some of those risk factors that could potentially combine into that perfect storm? We first are going to talk about some health conditions. On the right-hand side of the slide, you see a lot of mental health conditions. People typically think of depression when they think of suicide, and there is certainly, you know, an increased risk, and that could even be one of the symptoms, in fact, experienced with depression. However, there's a lot of other mental health concerns that you see here that could elevate risk for suicide that we need to check in on our loved one. For example, if they're struggling with anxiety, we don't want to overlook that. Or if they're managing, you know, ADHD and the impulsivity that comes with that, just as an example. On the left-hand side, you see some other types of health conditions, chronic health conditions that a person is having to manage. Pain, physical pain is another significant risk factor, as are traumatic brain injuries. We're certainly seeing a lot more research in the past couple of decades about traumatic brain injuries, in particular within sports, and how that could increase risk. So it doesn't mean if you have any of these, of course, that you're going to have suicidal thoughts or that you're going to die by suicide, but we want to just have this on our radar. There are also significant environmental factors that we want to be aware of. We're going to touch on this particular one, the first one here, twice, and that's on purpose because it's very important. And that is simply having access to lethal means in your environment. The majority of people who die by suicide die via firearm. And we want to be very mindful of keeping firearms out of reach of individuals, out of access of individuals who may be thinking of suicide, and certainly away from our youth. They're not equipped to deal with those at this point, of course. So we want to keep that in mind, but we also look at things like stressful life events. These may be things that are more chronic and long-term in nature, or they may be more short-term, and you see some examples of this here. We also know that having lost someone that you love to suicide increases risk for suicide. This is absolutely not an immediate causal relationship. I had someone recently say to me, well, if this person in my life died by suicide, does that mean that this is going to happen to me too? And the answer to that is no, it does not mean that that's going to happen. It means you need to be more aware, though, of your mental health and make sure that you're getting the support that you need. We do not have to directly know the person, by the way, that has died by suicide. It could be someone in our school that we never even encountered. It could be, you know, a celebrity. There's actually a lot of interesting research about how we handle celebrity deaths by suicide and how that can increase risk for anybody, right? And most of us do not know these celebrities at all. So you really just want to keep an eye on that. And that's part of why, if there is a loss in any of your child's communities that they're a part of, whether it's their church or their team or their school or their neighborhood, anything, we want to make sure we're talking to them about that and giving them the support that they might need. If there's a lack of access to healthcare, including therapy, that's another environmental risk factor. We do know that treating mental health issues can be a part of preventing suicide. Academic stress of any kind, as you see some examples here, can be an additional environmental factor that increases our risk. And then being a member of the LGBTQ community, it's not that they are per se in some way uniquely at risk. It's that they often lack a supportive environment. So there's nothing about being LGBTQ itself that means, hey, you're at a greater risk, but it's that they may not have the support that they need, and they may have an environment that in some way marginalizes or stigmatizes them. And that is what will increase the risk. And then this last section here, historical factors. Previous suicide attempts do lead to an increased risk of death by suicide, as do any forms of self-injury. Self-injury without the intent to die could be things like cutting, burning, anything like that is going to raise that risk as well. We talked a little bit about knowing someone who's died by suicide, which ties into family history a little bit there as well. And then any history of abuse or trauma increases risk. There's some great research out there about how exposure to trauma, when it's not treated, not addressed, can really increase the risk of dying by suicide as well. All right, any questions so far? Awesome. So let's talk a little bit about warning signs. So risk factors are things that, may increase the likelihood of something happening. However, it doesn't mean it's going to. When we are hearing warning signs are going to be different than that. These are going to be signals to us that there is more imminent risk for our loved one. These are things that they may be saying or doing in the days that lead, to them struggling with suicidal thoughts. The first thing we want to talk about is words. What might we be hearing from our loved one? I want to say, before we go through some of the details of this, that any talk of suicide should always be taken seriously. I hear from families a lot that they think, oh, maybe this is just attention seeking, or, oh, she's trying to get out of, going to take that test tomorrow, things like that. That could be true. We don't know. And we want to err on the side of caution here. We want to take this seriously every single time, because it's not something that we want to be wrong about. So here are some of the things that we want to listen for and take seriously. If they talk about killing themselves, ending their lives, right? That's pretty direct. But if they're talking about their life has no purpose, they have no reason to live, there's no reason to get up and go on tomorrow, that kind of hopelessness is a red flag for us as well. If they say that they think that people in their lives will be better off without them, things like, all of your lives would just be easier without me, or it'd be no big deal, you guys would be sad for a short period of time and then you'd be fine, life would actually be easier. Those are things we want to listen for. If our loved one is talking about feeling trapped or stuck, if they feel like they're in a situation that they see no way out of, that's something that we absolutely want to take seriously. And the same if they're talking about just being in overwhelming emotional pain, just saying everything hurts so bad, everything is so overwhelming, nothing feels right. Those are the types of things that we may hear from them. We also may see some changes in behavior. If we see them starting to use drugs or alcohol, or increasing their use of either of those in significant ways, then that might be a red flag to us. Certainly, if you find on your kid's phone or other devices that they're researching ways to die, that is very significant. We want to take that seriously every time as well. We do sometimes see that adolescents in particular will start increasing their risk-taking behaviors. So for example, maybe they're crossing the street and they don't even look both ways, they just walk right out because they are thinking to themselves, I don't really care what happens here, whether I live or I die. If you see that kind of risk-taking behavior, this could be a warning sign. If you see significant withdrawal, this goes beyond, teens like to spend time in their rooms, right? I've got teenagers myself, or one teenager, and Jennifer does too. We talk about these two teens a lot, and let me tell you, they like some time by themselves, but this goes beyond that. This is not wanting to spend time with friends anymore. This is just true avoidance and withdrawal from people and activities that they have previously really enjoyed. That's when we know that this is more of a problem. If we see changes in sleep, if they're sleeping too much, not sleeping enough, etc., there's a lot of research that's coming out now that insomnia is significantly associated with suicide attempt and suicide death. So we want to take that seriously. If they start saying goodbye to people, and sometimes this goodbye could sound a little normal, but a lot of times people have shared that this goodbye sounds a little bit different, just something in their gut pulls at them and they're like, wait a minute, this feels a little off or different, right? We want to listen to our gut on that. They start giving away things that they care about, or they're getting into arguments or fights. You see more aggression, verbally or physically, perhaps. If their schoolwork is starting to decline, that can be a sign. And if there's changes in their appearances, a lot of times people are struggling to take care of themselves when they're struggling with the will to live or not. So that's another behavioral warning sign. And then our last group here is mood. So what kind of mood or emotions might we pick up on? We've mentioned depression already, and we've touched a little bit on that loss of interest, right? That just sense of apathy about their relationships, their hobbies, their schoolwork. It's going to occur in a lot of different areas of their lives. We might see rage, which goes along with that verbal and physical aggression. They might just be more irritable, right? Sometimes I'll have parents use the word moody to describe that irritability, but they're just more irritable, more agitated than normal. If we have an adolescent or an adult, but who's gone through a significant humiliation, some kind of significant loss of status, where they're dealing with humiliation and embarrassment and shame or guilt, that can be a part of this as well. And we've touched a little bit on anxiety, but then impulsivity, right? Again, if you're seeing that impulsive behavior, they just don't seem to be thinking things through very well. And in particular, if that's a change or a increase in their impulsivity, we want to pay attention.
So before we dive on, any questions about any of that? There was a lot of information that we just put out there, and important to know the difference between risk factors and warning signs. Amanda said it, but I'll kind of reiterate as we go in. It's the idea of knowing that there may be some stuff that's there, using that heart disease analogy. Just because maybe there's high cholesterol doesn't mean you're going to have a heart attack, but we want to pay attention. Whereas when we really begin to see those warning signs, we want to make sure that we're beginning the dialogue. We're starting to ask questions. We're not just making the assumption that everything is fine, right? So any questions about any of that? No? All right. So I feel like I get to take, Amanda does all of the heavy lifting in the sense of talking about all of it. I'm gonna bring it home with some hope. So when we think about risk factors, on the other side of that, we think about protective factors. These are the things that we can look at and build on in a positive way to try to make change or to turn the corner with our loved one. And so we really begin to look at both things we can do physically for ourselves, for our physical body, for our physical well-being, as well as what we would call behavioral and mental health. And the number one place that we start when we're working with individuals that are struggling with suicidal thinking is building hope. Trying to have them create for themselves. Amanda spoke about a minute ago about the concept of a life worth living. What does it look like to begin to see ourselves not as a burden, but what we offer and what we bring, which is true for every person? Right? Trying to bring the idea of finding interest again. So the loss of, or the opposite of that loss of interest and apathy is turning towards, what is it that I'm interested in? What can I begin to build on? Really finding strengths, things that we're interested in, ways that we really do impact the world in a positive way. So building hopefulness and kind of what we talk about, that future-oriented thinking, finding things within the future to begin to build off of. And those can be really small steps, but incredibly important. Creating opportunity to have access to care. We often hear from individuals that they feel that nobody cares, that nobody notices. And most often the opposite is true, but helping individuals find that. So whether it be a trusted adult, a teacher, a counselor at school, a coach, if you're involved in a church organization, a pastor, or somebody that works with teens or youth, right? Or a therapist, your pediatrician is a great place to start. For those of us with parents, one of the number one questions we'll get is, where can I go? Where can I turn? And reaching out to your pediatrician is a great place to start. They often have access to different counselors and therapists. So creating that opportunity. At the end of this, we'll share with you guys a bunch of different resources. There's phone numbers that you can call, websites, apps. It's really remarkable. We can have lots of opinions about social media and its negative impact, but there's some actually really great things that are out there of ways that we can access different means to get support even in the immediate. it can be incredibly protective or can really bolster people when they have the ability to be what we call cognitively flexible or psychologically flexible. So one of the things that Amanda talked about is kind of that black and white thinking that we can see people struggle with, the idea that they believe that there's no other step that they can take, right? This is the only way, this is the only option. So trying to begin to create some flexibility. I feel really bad right now, and I know that people love and care about me, and we can find hope. So trying to begin to create a little bit of space in a person's thinking, allowing them to maybe be a bit more future oriented, and then beginning to tap into some of those problem solving skills. So instead of believing that there's no solution to the problem, beginning to tap into what are some things that I can do for myself? How can I begin to ask for help? How can I begin to start conversations? How can I begin to create finding some space when I feel like the schoolwork has become so overwhelming or the social relationships have become so hard? So trying to help people through that access to care, create some space in how they think, and begin to tap into some of those problem solving skills. Beginning to try to increase positive self-esteem. So instead of focusing on that lack of self-worth or feeling like we're a burden, really creating a shift around finding those unique qualities of each person and building that up. And finding a way to increase social and emotional wellness. Finding physical wellness. Oftentimes people will disregard their physical health and its impact on their mental health, but those two things go hand in hand. And, Amanda highlighted sleep, making sure that our students are eating well, that they're getting enough sleep. Some adolescents do not love the word exercise, but broadening the idea of what that looks like. Right? I mean, it doesn't mean that you got to go out and run around the track, or you got to get on the treadmill, or you even have to go to a gym. That's the number one thing that I hear. I personally hate a gym. There's a lot of different ways that we can get physical activity. And this can be, getting out and getting into a garden, yoga, riding a bike. There's lots of different ways that we can begin to move our bodies, and the positive impact chemically on our brain, how we even feel successfully. It's an accomplishment. Every time we engage in a physical activity and finish it, we've accomplished something, which we can then build on in our self-esteem. Look what I did. I finished this thing. I accomplished a task. And then the impact on our brains and the chemicals in our brain, all of those positive, the dopamine, the serotonin, the endorphins, those are all our happy chemicals. All of those are increased when we're physically engaged. Finding effective coping strategies. So oftentimes, individuals have lots of coping strategies that aren't so great for them, but increasing those ones that really are healthy, usually involving positive interactions with other human beings, healthy distractions, finding ways that a person can feel engaged that also allows them to be interested. Just having a dialogue today about the difference between knowing what you're good at, but also enjoying what you're good at, and that those two things actually are different. And it's really important to enjoy what you're doing, not just feeling like you're good at it, which is sometimes what we hear from our athletes or our musicians or our students who are involved in theater, right? Just because somebody has done something for a long time doesn't mean that it still brings them joy. And so finding something that does increase, again, building on positive self-esteem, feeling accomplished, and then really having a sense of purpose. Sometimes people talk about this as an idea of values, but really deciding what's important to you and establishing that for yourself, kind of your why behind why you get up each day, why you go about it. For a lot of our students, they don't have a choice about what they get to do when they wake up, right? School is what they get to do when they wake up. But can they find purpose in how they choose to spend their time after that? And then for our adolescents, that's an important thing for them to figure out, right? It is okay for them to have their own set of values and to have something that means to them and something for them to look forward to in those hours that they spend outside of school. So social and environmental factors that can really contribute to a student keeping themselves safe and healthy is connection. Humans, we are, human beings, we are animals, right? We are wired to be connected to other human beings. right? We're wired to have friends, a connection, or a family. For lots of people, this looks like lots of different things. That word family doesn't mean the same thing that it used to. And we really want to highlight that families look really different. That sometimes it's not even necessarily the family that we're born into, it can be a chosen family. And that's really important to identify for some individuals. Having access to teams or clubs, right? At a school like Myers Park, I can only imagine how many different clubs or activities that a student can be a part of. And finding something that really does, again, go back to that idea of what brings them purpose, what allows them to feel interested and motivated. Being in a positive school community environment. I mean, it is so lovely that Myers Park is doing this, and that, you know, we're being invited to come in tomorrow to talk to the teens. Hopefully you guys all know as parents that we'll be there tomorrow talking to your students. That's a really amazing way to create community, because it gives a shared focus of saying, we care about you and we see you and we want you to feel seen. Those are all ways for students to feel connected. We talk about the fact that as long as a student feels like there is one caring adult in their life, just one, that can be incredibly impactful. So again, a teacher, a coach, a director, anybody within their community that just sees them for who they are, and for a student to feel like they have somebody that they can go, that they know cares about them. We do know, as much as sometimes Amanda talked about, that there can be judgment within certain religious groups and organizations, that a student feeling a part of something bigger than themselves, whether it be their cultural orientation or even a religious group, can dissuade suicide. It can help an individual, again, feel like they're a part of something bigger than themselves, that they matter. And that can be incredibly helpful. The concept of faith or spirituality is a big protective factor for individuals. It doesn't necessarily mean that they believe in one thing or the other, just that they have something that they recognize as bigger than themselves, and feeling like that they have something that is connected to. Again, we highlight a protective factor. So on the other side is being restricted access to any sort of lethal means. Just knowing that the possibility of having a way to end their life is distinctly restricted is going to keep them safer in the long run. So it's on both sides. And then restricted access to alcohol and drugs. We are not going to be naive that this is not happening in the environment of Myers Park, right? We're going to be really honest about that. But we also need to be really clear that if we are restricting access to this, it's going to limit the possibility of a student struggling in a way that's going to then impact how they see themselves in their life. And then making sure that we create an affirming environment where a student feels that no matter what their orientation is, that they are going to be seen and accepted for exactly who they are. And so making sure that there is an LGBTQ affirming environment for a student to then feel like they're safe. There's a really strong connection between an individual feeling safe and then feeling like they have a life worth living, which even goes back to what we talked about, a risk factor of abuse or trauma. When an individual does not feel safe in their environment, they don't feel like their life is then worth living. On the flip side, if a student really does feel like they're loved and cared for and seen exactly how they are, that makes them feel like there's hope. But before we kind of go into the idea of what can we particularly do, any questions about what I just shared?
There are no questions so far.
All right, we'll keep going. So the tagline for the American Foundation for Suicide Prevention is talk saves lives. Starting conversations, starting dialogue, asking questions can make the difference in an individual making a decision to either choose life or maybe to not. We really want to begin to normalize having some hard conversations. We often laugh and say that this is the other S word, that oftentimes people are afraid to say the word. People will often believe, it's a myth, that if we ask a person if they're having a suicidal thought, that we've planted an idea in their head. And we know that 100% this isn't true. We have research that shows that by the time a child is 8 or in the 3rd grade, They understand the concept of suicide. They understand the concept of ending their own life. So we're not planting ideas into anybody's head, right? And unfortunately, we know because of the way that media is works, suicide is out there. It's talked about. It's in the news. It's on social media. So we have to make sure that we're having those fact-based conversations, that we're using the word suicide, that we're normalizing that. So we have to have this dual approach as a parent or a teacher or a caregiver or a coach, proactive and reactive conversations. So from a proactive standpoint, if you see any of those warning signs in particular, have the dialogue, ask the question, are you thinking about ending your own life? Are you having thoughts of suicide? Ask the question, be proactive. Then on the flip side of that, if there has been a significant event that's occurred in somebody's life, those risk factors, a significant health issue, a traumatic event, we want to be reactive to that by saying, we know this major thing has just happened. Are you having thoughts of suicide? We know that there's been perhaps a suicide in the community. How are you feeling about what's happened? Do you feel like you're having any triggers around thinking of ending your own life? So we want to think about this as bookends, but really feeling like at any point in time, as Amanda said earlier, if we have a gut feeling, we want to ask the question. And we want to be direct. We don't want to read around the bush saying like, are you feeling okay? How you doing? We want to come right in and say, are you having thoughts of suicide? Are you ending your own life? And so we really do encourage parents to practice. Sometimes you can practice with a friend or your partner or your spouse. Sometimes we even talk about practicing in front of a mirror. That's not my favorite way to have those conversations. I end up feeling a wee bit silly. It's easier for me to have them one-on-one, but we really do encourage that. And it's going to then help make it feel more comfortable when you go to talk to your teen or to your student. When we think about proactive, just like you would have any other important conversation, right? If there was something coming up, I was just thinking about having a conversation with my son the other day where he had built trust with us, and I was having a proactive conversation about building trust in the little things means that I can then trust him with bigger things. You have conversations with your students, I guarantee you, about their grades all the time. Are you doing your homework, right? We're proactively trying to make sure they don't get behind. Okay, so we want these conversations to be the same. And again, we're not going to plant any ideas. And we want to be really careful with that non-judgmental approach. Simple, straightforward. We don't want to infuse it with language, that Amanda had kind of highlighted before that has any sort of statement about a person's character. We just want it to be fact-based. And we really want to normalize mental health as the same thing as physical health. If your kids came to you and you said, oh my gosh, mom, my ear is killing me, you would go, oh my gosh, maybe you have an ear infection. It's very normal. We don't panic. We just problem solve. We have a dialogue about it. How long has your ear been hurting you? Okay, let me call the doctor. Let me get you in. We'll get you some antibiotics. We want these conversations to be the same. I'm really feeling anxious. I'm really feeling like I'm scared. I don't know what to do. Okay, tell me a bit more about that. Open-ended questions. Tell me more. Tell me a bit more of the conversation. And then we go into kind of the same proactive problem-solving mode. Okay, let's go ahead. Let's call the doctor. Let's see who we can get you in, because it's all the same. Really helping individuals normalize and begin to see that our physical health is just like our physical and mental and emotional health. Really underscoring that we will always be there for them. We are always present, that these conversations are always welcome. They're always okay. It's never too late at night. It's never too early in the morning. We're never too busy, right? Really highlighting our presence. And again, asking directly, using that S word. And then having access to resources and supports. We'll talk about this a bit more at the end, but it's really great that we've just had implemented nationwide the 988, kind of like you would dial 911 for a medical emergency. We dial 988 for a mental health emergency or crisis. And so it's become really simple. There's always something at our fingertips that we can use in the immediate if we need it. If we're really worried, we want to make sure that we're setting up these conversations for success. So we want to make sure that we're talking to our individual, to our loved one in private. This isn't something that we want to do at the dinner table around siblings. This isn't something that we want to do in front of their teammates on the soccer field, right? We want to make sure that we're having a one-on-one conversation with them in private. It's going to much better create an environment for somebody to feel like they can be honest. If it's not in private, if it's not in a space where they feel like they can be honest, they're probably not, right? They're going to say, I'm fine, it's fine. We want to make sure that we're really listening. We want to make sure that our phones are away, that we're not distracted by a computer screen, that we're really demonstrating in our body language with our facial expressions that we are listening to what they have to say. We're not interjecting, we're not interrupting, right? Again, we're staying away from that judgmental language. We really want to, in that moment, express concern and care. Thank you so much for telling me. I'm really worried about you. That's an okay thing to say. It's showing concern. It's showing that person that we really care about them. When we worry about somebody, that's care. And it's perhaps counteracting the belief that they have that nobody cares, right? We want to, again, ask those direct questions. Are you thinking of ending your own life? Are you having suicidal thoughts? And even doubling up on that question, because if we could say sometimes, are you thinking of suicide? That may not be enough for a person to even connect that that word even means I want to end my own life. So we want to ask both. And then connecting them to a mental health service, right? Calling up a therapist, pediatrician 988, your ER 911. We want to do something in the immediate. And we may not immediately be able to get in with a therapist, but I guarantee you can get in with your pediatrician the next day, right? And if you as a parent are so concerned that you don't even feel like it can wait to the next day, please do. Go to your local ER, dial 911, don't wait, right? And again, it's showing the appropriate level of concern and care for your loved one. If they're really expressing to you, they're thinking of ending their own life, we want to respond with an equal amount of concern. If you believe that a person is to the point that they may make an attempt on their own life, please do not leave them alone, right? This isn't even the time for me to be like, okay, well, I'm going to let you just hang out here and I'm going to go manage this. You want to stay present and with the individual. If they've just been vulnerable enough to be honest with you, they're going to maybe feel a little vulnerable. They're going to need that support. Please stay with them. If there are any lethal means within your home, please make sure that you or somebody else is securing them and removing them from your home if necessary. And then making sure that we are escorting that person to their own mental health care. It isn't the time for them to drive themselves, right? We want to make sure that we are going with the individual to get the support that they need and being willing to stay with them through that whole process to make sure that they continue to feel supported. So before we jump in kind of in the answer to resources, any questions about anything that I just shared? Okay. So we'll dive into some resources here. So there is now the National Suicide and Crisis Lifeline. So just like dialing 911, all you would do is dial 988. It will connect you to a live human being that is trained to be able to intervene. There's also the text line, 741-741, right? So again, pretty easy to remember. It's free, it's 24/7, and it's 100% confidential.
So a couple of other resources we want to share with you all. The Trevor Project is designed to support our trans individual community, and you see some of that information there. We also have seizetheawkward.org, which was developed in partnership with AFSP and several other organizations. It's got some really cute, very teen-friendly, kind of videos and wording about how to talk to a friend if you're worried about them. It's a great resource for adolescents, as is To Write Love on Her Arms. It's another wonderful resource for just finding mental health support in your community, and they also have some online support through that as well. And then NAMI that you see there, and we're gonna share the other one with you in just a second. And then AFSP.org, there's a lot of free information that we have for you there. We provide trainings and information about prevention, intervention, and what to do if you've lost someone to suicide. So it's a great place to get all of that. And then the apps we want to highlight here for you last. The first is the Not Okay app. This was actually developed by these two teens, brother and sister that you see here. The sister has some struggles with her mental health as well as some physical health conditions that have further amplified her mental health struggles. And she came up with this app in conjunction with her brother as a way to basically have an emergency button that she can press on her phone that lets her select contacts know that she's not okay, that she could use some support. And now it's an app that's free and widely available, and has been researched and vetted, if you will, as a really good one that's out there. So it's great for your teens to be able to communicate with you if they're not okay. And like Jennifer said, we want to be available if they really are having a struggle and need our support. And then the last one that you see here is the Virtual Hope Box. This is an app that was designed by the VA, the Veterans Affairs Administration. It is in no way affiliated with, being a part of the military. It really just means that your tax dollars paid for it, and that it is really well researched because your tax dollars paid for it. But it's been shown to reduce suicidal ideation as well as helping to cope with other levels of stressors. So you see you have different categories within this app of healthy and effective coping skills. And there's also the ability to kind of customize this, and it's free. Both of these are free. So we wanted to share those with you all tonight as well. Just some other ways to get involved. We love, of course, that Myers Park has this mental health initiative and committee. You can be a part of that. There's other things. In fact, I saw some Myers Park community members at our recent Out of the Darkness walk that the American Foundation for Suicide Prevention had here in town. So just kind of, again, modeling and putting in front of your teens that this is okay to talk about. Like, this is a part of our health overall. Like Jennifer was saying, everybody has mental health and we can talk about it. All right, last call for questions.
So nobody has written a question, but I remembered that last year when we talked to the kids about, well, the number wasn't working yet, but we knew that 988 was going to be that number. And kids were concerned about, well, when should you actually call? Is it only when you have somebody right next to you who's going, who says they're going to, end their life right now? Or, is someone going to come to your house, or is it just to call and talk to somebody? I wondered if you could kind of give parents a little guidance about when and how to use that number.
Yeah, absolutely. So 988 is really for any type of mental health need, right? So this could simply be a teenager extremely stressed in the middle of the night and they're unwilling to go wake up their parents, but they're willing instead, to call 988. It does not have to be just a suicidal crisis. So that's one thing that's really important to know. The other piece is that while yes, it is confidential, there are exceptions to that. And this is what one kid asked about last year. I remember this question as well, Katie. So in only 2%, and this remains true for 988 so far as well, only 2% of all calls that they receive end up being transferred to like geolocation services where they have to send out the police or EMS. And that is when a person is saying, I am going to end my life. Here is how I'm going to do it. And I'm going to do it right now, right? So it's either that they reach out to local emergency services or that person dies. That is the only time that your information is shared or tracked or anything like that. And again, 2% is a very low percentage.
It really is affected by the lethality, right? The idea of that lethal means. And then at that point in time, it's always the idea that safety trumps confidentiality. So in that moment, they have to go ahead and intervene for the sake of keeping a person safe.
And you can call 988 if you're worried about your teen, for example, right? It doesn't even, because there is a wait sometimes to get in with a mental health professional, or maybe it is the middle of the night and your pediatrician's not, available at that moment or whatever. So you can call and reach a trained crisis counselor. It does sometimes take a little bit of time, so you may have to wait a few minutes. to get somebody to answer the phone. That's something we'll mention to your kids tomorrow too. 988 is actually seeing a higher call volume than we saw with the National Suicide Prevention Lifeline, I think, because it is so much easier to remember, and we're making it much more clear that it's broader than just suicide prevention. And so we are seeing a little bit of a longer wait. So just if people can kind of maybe expect, okay, I may have to hang on hold for a few minutes, like when you call your doctor's office, you usually have to too. But someone is going to take that call. Someone does want to speak with you and help.
Thank you.
Yeah.
Okay, so there's still no questions, but I have another one that I think might be helpful. So I was wondering if you could also just talk a little bit about how a parent could respond if their child comes to them and says, I'm worried about a friend of mine. They've been talking about wanting to end their life. What should I do? What should a parent do in that instance?
So I'm sure we'll both have thoughts on this. I mean, I think the number one thing we want to do is to reiterate that it's a really good thing that their student came and talked to them. Right. So I think the first thing we want to say is like, thank you so much for coming and talk to me. I'm so glad that you came and talked to me. So doing a little bit of information gathering, then validating for them that that is bigger than them, right? That is not, they are not a trained therapist yet. We'll like push the future of therapists and psychologists out there, but that's bigger than them. It validating that it probably does feel overwhelming because it's a really big thing, and it's too big for one person to just carry on their own. And that then again, that idea of if they're really hearing their friend talking about ending their own life, that we need to do something about it. So again, that idea of going ahead and needing to reach out to a trusted adult involved in that person, the person that's struggling life. And the number one thing we hear is, but the person's going to get mad at me, right? And so really kind of trying to proactively validate, yeah, this person, we're going to have to go ahead and intervene, but you're actually being a really good friend. This actually came up with the students last year, that a student asked this question, and really highlighting that you're actually being a really good friend by sharing with a trusted adult, by getting them help. And so trying to just kind of stick to the facts of that. We're not going to say to them like, oh, it's okay, we'll just keep this between us. No, right? We've got to act. We have to get that person help and support, but then also taking them out, like the pressure off them. Like as a parent, I'm going to go ahead and help with this. Right? We're not going to put it on the teen like, oh, okay, well, now you need to go call so-and-so's parents. No, right? Again, we're reiterating this is too big for them to be managing as an adolescent. The adults are going to go ahead and take over. And so you don't have to worry. We're going to keep this person safe.
I completely agree with everything Jennifer just said. And that barrier of they're going to be mad at me is absolutely the most common thing that we hear. And sometimes I will say to an adolescent, well, would you rather than be mad at you for a couple of days or a couple of weeks or not be here? And usually for adolescents, that's a very, very quick answer. Like, okay, I will take the risk of them being mad at me because I want them to be here. I want them to be okay.
Yeah.
Those are great questions, Katie.
And it really is okay for you parents to go ahead and call that person's parent at that point, right? I mean, oftentimes I'll hear from parents like, well, I'm worried, I don't want to feel like I'm overstepping, or, and it's like, no, that's a moment that you go ahead.
I will say Jennifer and I both work a lot with families who've lost a loved one to suicide, and I've never had a family member say to me, gosh, I just, I'm so glad no one called me who knew that they were thinking of it, right? It's the opposite. Sometimes I say, man, I wish these people who heard some of what was being said had told me, because then I would have had a chance to try to save my child or my loved one.
Those are all really good points. I think it's really nice to be very concrete, because lots of parents are just confused about how involved should I get? What should I do? Maybe it's not as serious as my kid thinks it is, so yeah, good advice. Thank you.
You're so welcome.
I don't see any other questions.
Okay.
Kylie, do you want to add any? No? Okay. Well, I just want to thank you both so very much for being here tonight. That was really good information. And I'm just you have your email up on the presentation page here on the computer. So if anybody needs to contact you, they can just email you, even if they have questions about tonight or.
Absolutely.
100%.
Okay. Wonderful. Well, thank you so much. And we will look forward to you speaking to the students tomorrow at Myers Park.
Thanks so much. Have a good night.
All right,
Thank you.
Bye-bye.
night.
Thanks for joining us.
Bye-bye.
Thank you.